in as little as 2 years. Thomas Moore, Sky News.
Joining us now is cancer surgeon Dr. Frank Chinegwundoh. Good morning to you. What's the position at the moment? How is bladder cancer diagnosed at present?
At present, it's diagnosed by passing a telescope through the water pipe and looking around the bladder. And the reason why you might do that is that the patient might say, I've passed some blood in the urine, or a doctor may have found traces of blood on one of these chemical stick tests of the urine.
So that's obviously an invasive procedure, and this new test would be the complete opposite of that. I mean, it must be quite revolutionary.
It's a very exciting development. If you can pick up the suggestion of bladder cancer by a simple urine test, then that will certainly be an advance. However, you would still have to confirm the actual diagnosis by passing the telescope into the bladder and taking a specimen.
But at least it would get you through that initial stage and alert you as to whether you need to proceed further.
Yes, it would.
And this actual test, what does it involve? How does it actually work? What does it tell you?
The test is just a urine test, and the basis of it is that cancers of the bladder produce this protein called EN2. So if you do a urine test and the test detects this particular protein, then that is a pretty good indication that there's a problem inside the bladder.
But there are other urine tests available now. How does this one differ? Why is it superior?
Yeah, this one seems to be a lot more accurate. With all of these tests, you want to know that the test is going to pick up the problem. The other urine tests that we have may only pick up half of the cancers that are actually there, whereas the early studies on this EN2 protein suggest that it will pick up probably 3/4 or more of the cancers that are there, so it's more accurate.
And this is a cancer it's the fourth most common of cancers, isn't it?
Yes.
Something I didn't know.
It's the fourth most common cancer in men and probably the 9th most common in women. So it's about 10,000 cases a year.
And somebody would present themselves to you with what sort of problems before you might carry out a test?
Usually it's blood in the urine. So what happens is that someone passes blood in the urine, they go to their GP, and that patient is fast-tracked to the hospital to see a urology specialist.
But this type of test presumably could be done in a GP surgery?
It could be done in a GP surgery, yeah, absolutely.
So that would make a huge difference to the patient?
Oh, yeah, absolutely. And, you know, if the test works out in larger studies, it could well be that if this test turns out to be negative, that you don't have to go through more invasive investigations. It's not at that stage as yet, it needs more studies, but that's the potential.
Yeah, definitely positive potential. Dr. Chinegwundoh, thank you very much for coming in this morning.
Thank you.
Charlie's joined us now to let us know what's coming up in the sport.
Gillian, morning to you. The biggest game in World Club football will be an all-German